Hello and welcome to Health Matters on Channels Television. Thanks for joining us. I am Mary Alale Yusuf. Every single year, between 50,000 to 100,000 women worldwide are affected by a reproductive condition called obstetric fistula. This is an abnormal opening between the birth canal and urinary tract or rectum. It is a pregnancy-linked disability which leads to obstructed labor. Women who experience obstetric fistula suffer constant incontinence, social segregation, and health problems. The World Health Organization estimates that more than 2 million young women live with untreated obstetric fistula in Asia and sub-Saharan Africa. And by the way, this is an avoidable condition. My guest is a public health specialist and executive director, Bashir Foundation for Fistula and Women's Health. Barakat Adewale joins us in our Abuja studio. You're welcome to the show.
Thank you very much, Mary.
Let me start by asking, why these abnormal openings occur at all? Why?
Okay, so there are a couple of reasons. One is, which is the major reason in Nigeria, is obstetric. So obstetric is a condition that comes up, that's obstetric fistula right now. It's a condition that comes up as a result of an opening, a hole between the vagina and maybe the rectum. That's the one that you would usually call the rectal vaginal fistula, or vesicovaginal fistula. So it usually happens when a woman is trying to give birth to a baby, and then there's a prolonged labor, prolonged obstructed labor that there's no immediate intervention. The woman doesn't get an immediate intervention when she needs it, and then she's in labor for 24 hours, 2 days, even some even go as long as 3-4 days in labor, and then they don't get the right intervention that they need. So the baby tries to keep forcing him or herself out of the woman's canal, and then creates a hole in the wrong places, right? So either between the bladder and the vagina, or the rectum and the vagina. So when it happens between the bladder and the vagina, it causes a leakage of urine from the vagina consistently, right, uncontrollably. And when it is from the rectum to the vagina, it causes feces, constant leakage of feces from the vagina.
Okay, so that's what you mean.
That is what actually causes
when you say
obstetric fistula. However, we have other types of fistula right now. So iatrogenic fistula is usually caused as a result of a medical intervention gone wrong. It could be hysterectomy. It could be a CS gone wrong. It could be any other kind of surgery gone wrong, causing a fistula to a woman that has just undergone any other kind of surgery.
Okay, but concerning when it comes to pregnancies, isn't cesarean section actually the intervention to use when somebody is having a long protracted labor?
Yes, CS is usually the most important intervention that a woman that is undergoing a prolonged labor, that's what the person needs to avoid fistula. Unfortunately, we have unqualified medical professionals carrying out this procedure and doing very, very serious damage to these women. Currently, if we look at in the north here, if we have 10 fistula patients, we can have as much as 3 or 4 cases that are iatrogenic as a result of a CS gone wrong, or hysterectomy gone wrong, or any other kind of medical intervention gone wrong. So where CS is supposed to be a solution, it could eventually become a problem when done under unqualified medical professionals.
Just for the sake of viewers, explain to us the meaning of obstructed labor, which I believe you were explaining in the beginning, but just tell us, what does obstructed labor mean?
Okay, so a woman is having a prolonged labor without any medical intervention, and then the baby is trying as much as possible to come out of the birth canal, but there is a reason something is blocking the passage of the baby. This could be as a result of a small birth canal, for example. We have cases of children that are too young to have babies, babies birthing babies, like we would usually call them. So they have a very small canal, and the baby finds a lot of obstruction trying to find his way out of the birth canal. We also have cases of small pelvis, not necessarily being children, but maybe stunted growth, maybe as a result of malnutrition. Even people that are short, they have these tendencies of having small pelvis. So, when you're going for antenatal consistently, they will tell you they're high risk. If you have high risk pregnancies, there are several reasons why somebody could be a high risk pregnant woman, right? So any of these factors could actually cause an obstruction from making from making a woman to be able, or a baby to be able to find an easy passage out of the birth canal, right? So this obstruction is now what causes fistula, especially when it is not attended to.
Okay, so can these holes, this fistula, can they be repaired such that the woman can be reproductively competent again?
Yes, we have a lot of surgeons. Many are very, very experienced and very, very qualified that are handling fistula surgeries. They have gone for the training, and it's a specialization of its own. They are used to different types of fistula because there are quite a lot of fistula. So they are used to different types, and they can take care of these cases. We have about 85 to 90% success rates in so many of the cases that we have seen. As I speak now, there are many organizations that are organizing free fistula surgeries. I know the government is also supporting in this regard. So there's actually treatment, there is repair for it, and we have about 85 to 90% success rates.
Do these conditions sometimes occur congenitally? Like maybe a girl is born with it? Does it ever happen that way?
Okay, so we have cases where we have small children that have this problem. But I'm not sure. It depends. Those that come with it from birth, I'm not sure we would really call it fistula. I think there are different other names for it. It's also a leakage, right? But there are different other names for it. But what we have realized again in recent experiences is that you assume that a child probably had it from birth. That's an assumption. But then by the time you start looking into the history of the child, you realize that so many of these cases are FGM related, right? Okay. So a child at how many months old undergoes a female genital mutilation, female circumcision, and then they cut what they are not expected to cut. In November last year, we had to take care of about three different children like that, age 7, age 9, age 10, no, I think 12. And the parents would assume that, oh, that's how she has been from childbirth. While in reality, it was actually the female genital mutilation that actually caused it. So while trying to cut a part of the child's private parts, you would realize that they cut where they are not expected to cut, and then there's a constant leakage of urine from these children.
In your experience, have you had people coming for a repair who have had a previous repair? Yes. In the worst that I heard in recent time was a patient that had 8
8 repairs and was here for the 9th. While our people were, trying to reach out and look for some of these women, but we also heard of another case that the woman said she had been through 3 surgeries and she's no longer interested in having any more surgeries. She would rather die like this and all of that. So, unfortunately, yes. So I'll give you 2 reasons why that happens. One is some of these surgeons or doctors that handle these cases are not qualified fistula surgeons. They may be gynecologists, they may be consultants, but they are not qualified fistula surgeons. We have people that are trained specifically as fistula surgeons. So, I do not know that I need to look for a fistula surgeon. I just go to the hospital and I ask for care, and then they tell me, oh, you have fistula, or you have a hole or something, you just need surgery, and then, okay, and then I go for surgery, and then they'll tell you, okay, I'll come back for another surgery, you need a follow-up surgery. This person is not a trained fistula surgeon. Another scenario is the case is complex. Maybe some of these first repairs have even complicated the cases even more. They have worsened these cases for us. It has now become, it's no longer a simple fistula surgery. It has now become an advanced case. And then you take this advanced case to a surgeon that only handles simple cases. And because he doesn't want to let you go or, tell you to go back home and all of that, or maybe he doesn't even know where to refer you to, he just decides to try his luck.
Okay,
and then this luck goes bad and even worsens the case further.
Let me quickly cut in
what
there.
we try to do is to ensure that we are looking at, okay.
Hang on. I quickly want to ask a question. The assumption is that somebody trained in gynecology and obstetrics would be able to handle an obstetric fistula and all things obstetrics. So are you saying that there has to be a specialist fistula surgeon? Is this the understanding you're trying to give us?
Yes. So even a gynecologist has specializations, let me put it that way. Some are specialized in fertility, some are specialized in cancers, those kind of things. But when it comes to fistula surgery, it's completely different. And that's why in Nigeria now we have dedicated fistula centers in Nigeria. Dedicated fistula centers in Nigeria. And in these centers, you will see that it is only trained, certified fistula surgeons that are in the centers.
Okay.
So we don't even, it is only in few teaching hospitals that you would go and then you'll see a fistula surgeon and all. But you see these people that have been trained and they are in the fistula centers, they operate hundreds of cases in a year. They have come across different levels of fistula. They are used to it. They know how to go about it. You cannot compare it to somebody that may not do a fistula surgery in an entire year. You cannot compare the what's the word now? The experience. You can't compare it. You can't compare their performance. You can't compare what they can and cannot do. Okay. So yes, it is very important that when somebody has fistula, the person meets a fistula surgeon, a certified fistula surgeon for the surgeries. We have cases where we have gynecologists right now that are going for fistula surgeries. So sorry to cut in there.
We need to take a break. When we come back, we'll continue on the topic. Please stay with us. Welcome back. It's Health Matters on Channels Television, and we're talking about obstetric fistula. At this point, you can call in with your questions. You can call 0808 054 2233. And you can also send a message on X at CTV_Mary A, while we continue the discussion with our guest, Barakat Adewale. So my question to you now is, does the government have any program to reduce the incidence of fistula because of how preventable it is?
Well, I know that there are programs to reduce the prevalence, the current burden. But as far as incidence is concerned, one program that I know that they are currently working on is trying to provide free cesarean sections in qualified centers for women with high burden, high risk pregnancies, right? To reduce, because I know most people who have this problem, it's because they are unable to afford the cesarean section that they need, the kind of intervention that they need at the time that it is most needed. So I think this is one major plan that the federal government has to help reduce this incidence. Generally, I know that they also communicate with stakeholders and work with other partners like us to help at the community levels and try to increase as much awareness as possible at the community level, at the grassroots level, so that people understand the importance of, delivery under skilled birth attendants, delivery under the right care, all of these kind of things. The problems that may arise as a result of early marriages or early pregnancies, all of these kind of things. So they work with partners like us that, work at the grassroots level, at the community level to reduce the burden of fistula in Nigeria.
So are you working on, for example, trying to convince people to increase the age or to let a girl grow up a bit before getting married? And in your opinion, how old should a young lady be before she starts trying for children?
Okay, so the accepted age, is from 18 and above. I'm sure any lady that is 18 and above is no longer a child, and we will not be able to. We can no longer call that person a child birthing a child. But when we have cases of a lady that is age 9, 10, 11, 12, birthing children, then that is a problem because she is still a child. And yes, that's why what we do is, at the end of the day, the people that make these decisions are the men. The men make these decisions. The women do not have the power or the authority to make decisions about their lives. If I want to go for antenatal, I need my husband to give me the money. I need his approval to go even when I have the money. If I want to go and deliver in the hospital and my husband says I don't have the money, I do not have a choice, I have to wait. My mother-in-law will probably tell me, oh, what's the problem? I give it to all my children at home. Why do you want to go and waste my son's money in the hospital? The husband will probably say at age 9, what's she still doing in my house? Let her get married to Alaji so and so. So it's the husband that makes these decisions. They are the decision-making authority in our homes, in the local homes, especially where this problem is more prominent. So we have to have a lot of dialogue sessions with these men. Let them understand the dangers that they are causing. Some of them cause this danger. They don't even know they are the ones that cause the problem. They don't know. So we always have to engage with these people at the community levels, at the grassroots levels. There's a lot of community engagement at the grassroots level that needs to be done.
Then also, if a woman, if there's a sort of campaign to get women to have something to do, it may not be something big, something near the house, sewing or something. She can make her own money, and I think that gives a woman power to say she wants to see a doctor.
So yes, this is very true. This is very correct, and that's why we at our end are doing a lot about women empowerment. Because I mean, if you tell me not to go to the hospital, and then I tell you, why don't you want me to go to the hospital? It's because I don't have money. Okay, then I have the money.
Exactly.
I have the money. I can take care of myself. Then so what we try to do is okay, encourage these women to have something to do, right? Especially the problem of fistula now is such that even after the fistula surgery, the person is dry, the person is fine, the person can no longer have vaginal deliveries, because any vaginal delivery may cause a relapse, right? So the only thing that can be done for that kind of woman is a cesarean section, and cesarean sections, as we know, are usually very expensive. So it is important to empower these women so that they are able to afford. I'm sorry, you said?
Let me cut in there and quickly take this call from Abubakar in Kaduna. Hello, Abubakar. What's your question?
Hello, my question, I said, is we are working with Women Disability Self-Reliance Foundation.
Please, could you speak up a bit?
I said we are working with Women Disability Self-Reliance Foundation. I'm working there. I want to...
I'm afraid we're not hearing you anymore. But
Hello?
you could... You want to know what?
Hello? Are you hearing me?
Yes, we are. Please continue.
I said I wanted to give contribution for the network, sorry.
Okay,
sure.
Go ahead.
I'll call you back. I'll call you back. Network.
Okay, you have a problem with the network. Okay, do try and call back. And thank you so much, Abubakar, for trying with that call. Let me ask, is there a way, to something these women can have in the interim to help their dignity before they do get into having a surgery? Like a bag, a patch or something, so that they stay dry. Is there something like that, or is it too expensive?
So, of course, in most cases, these women cannot afford any anything other than the clothes that they put under. They just put clothes there, and that's basically what they can afford. So it is until they get the intervention that they need from various organizations that support them, bring them to the facility, and then provide them with hygiene materials to help them before surgery, and even after surgery, they still support them until they are declared dry.
Okay, so this is a slightly delicate one, but I think I need to ask it. When you have a meeting and you say, oh, we want to sensitize people, we want to talk to them, women will generally listen to you. But has anybody thought of gathering men and talking to them about these things? We're not saying she isn't your wife or you can't marry her, but can you wait? Do you have meetings like this?
Yes, most of our dialogue sessions are actually with men. It's rare. It's not out of place to have meetings with women occasionally. But most of our dialogue sessions, most of our meetings at the community or grassroots levels are with men. Because like I said, they are the decision-making authority in the homes. They are the husbands and they are the fathers. They are the ones that decide when we get married, and they are the ones that also decide if we should go to the hospital or not. So most of our dialogue sessions are with the men, and most of the men that we speak with and communicate with tend to understand where we are coming from, and they tend to appreciate it and say they'll go back to the communities and get better. But we have to do lots and lots of that. And to be honest, security situations in certain parts of the country is even making it really worse. We've been doing a lot of work in Kaduna. We've seen improvements. But recently we moved to Zamfara, and we realized that the cases in Zamfara is worse. And you can blame that on, the culture and the level of awareness, but also security.
Well, I'm afraid we have to anchor it here. Thank you so much for the work you do, Barakat Adiwale. And please don't stop. More power to your elbow in this matter. And I hope that your sensitization campaigns will go far and wide so that we can reduce the incidence of this phenomenon. Thank you for coming on the show.
So much for having me.
Thank you, viewers, for being there. Have a wonderful day. I am Mary Alale Yusuf.